Root canal treatment is a treatment that's undertaken when the nerve in the tooth is in jeopardy. What this means is that the nerve in the tooth is infected or on its way to becoming infected. In the X-ray here, you can see an upper front tooth, and you can see the white hard outer enamel. This is the portion of the tooth that we can see. The bulk of the tooth is made up of this grey dentine, and at the very centre you can see a darkness running down the centre of the tooth. That's a small channel like a tube which runs at the centre of the tooth, which has an opening at the tip, in which blood and nerve vessels from the surrounding bone enter, come in the tooth, circulate, and then come out again. If any bacteria manage to find their way into the root canal system, because the blood supply to the root canal system is so sparse, there isn't enough of a defense response to be able to defeat the bacteria. And so what happens is the bacteria multiply and multiply, and they occupy the whole of that root canal system at the center of the tooth. If they were to have stayed within that tooth, then that would be fine. But what happens is that they try and spin out through that small channel, the opening at the tip of the root, into the bone. But the bone has got a good blood supply, so you get a congregation of your own defense cells coming to the tip of the root here, successfully stopping the bacteria from coming out and occupying that bone. But as a result of the increase in activity at the tip of the root here, you get an increase in the number of dead white blood cells that build up, and an increase in the number of dead bacteria that build up, and they build up, and they form an abscess. So that's the story of how an abscess forms, and it's this really that we don't like to happen within a tooth. So the solution, we have two options. One option is to remove the tooth, and if you remove that whole tooth, then all the causative bacteria that are causing the trouble will be taken out, and the body will be able to heal. Another option is to perform root canal treatment. Root canal treatment is where we place very fine instruments after having gained access to that nerve space, place very fine instruments into that tooth painlessly, all the way down to the tip of the root, and clean and disinfect that space that the bacteria were living in. After having cleaned and disinfected that space, we would then fill right down to the very tip of the root, and then subsequently fill the access hole that we make to reach that nerve space. What you can expect with a root canal treatment when you come is that you will be asked to take a seat. We make sure that you're feeling down and anaesthetised so that you don't feel anything during the procedure. And we'll put a special blue sheet, which is a barrier, over your teeth to make sure that any of the disinfectants that we use don't go inside your mouth. The procedure will take between 1.5 to 2 hours, and we may need to call in more than once. Because the root canal system is complicated and contains loads of nooks and crannies, we don't always successfully clean it out, and some bacteria can remain within that tooth, and if they do, then this can sometimes cause failure of the root canal treatment. Success ranges between 70% and 90% depending on how complicated the tooth is, and your dentist will give you an idea of what the likelihood is of success in your particular case. A huge component of the success rate of root canal treatments is how much tooth structure there is left of the tooth, and quite often what we have to do is take off any restorations that there may be within the tooth in order to find out whether the tooth is salvageable or not. So that's the story of how we perform a root canal treatment and why we perform it as well. And you should know that it's a painless procedure. It's important to know that if you do feel any pain during the procedure, that you tell your dentist, and then they can stop and administer more anaesthetic, because we want to make sure that this whole process is a comfortable one for you. Hopefully we've answered some of the questions that you may have had about root canal treatment, and if you have any further questions, then don't hesitate to get in touch.